Hi, my name is Ali Pramada, and this presentation will be a psychosocial case study of one of my patients from fieldwork. In order to address the patient's psychosocial factors, I provided interventions focused on education and health promotion. I provided the client MW a list of 75 leisure activities and had her identify which leisure activities she used to engage in, currently participated in, and wishes to be involved in the future. The purpose of the intervention was to maximize the client's engagement in leisure activities and increase her participation in meaningful activities. The patient was also provided education on how lack of leisure activities can negatively impact mental health and overall well-being. Because the patient struggles with stress management, leisure exploration and engagement are especially important for her. After the client identified preferred leisure activities, we engaged in a discussion regarding how to incorporate more leisure activities into her everyday habits and routines. For example, she decided she wanted to prioritize walking her dog every morning before breakfast and every evening after dinner. Additionally, she reported she wants to try to cook a heart-healthy meal each week, trying out a new recipe. The frame of reference that supports this intervention is the cognitive behavioral frame of reference because it supports stress management techniques in psychoeducation. The CBT frame of reference emphasizes the importance of an individual's behaviors, thoughts, emotions, environmental factors, and physiological responses, and how they all impact occupational performance. It is also used in conjunction with other occupation-based models to maximize therapeutic outcomes. One model that pairs well to support this intervention is the Canadian model of occupational performance and engagement, as this model emphasizes how the person, occupation, and environment all interact and impact overall occupation performance. This model is also used to better understand the client's perception of their occupational performance and motivate them to engage in interventions. Lastly, the CMOPE has been widely implemented among various occupational therapists to address leisure explorations for clients. If the client was not impacted by psychosocial factors such as stress, anxiety, depression, unstable living conditions, health issues, and financial barriers, the intervention would not have been as client-centered or appropriate to implement with this patient. Clients who face little adversity or have not experienced these psychosocial factors may not need occupational therapy interventions to target stress management or leisure exploration, as they may already have a healthy occupational balance. Additionally, individuals who do not struggle with mental and/or behavioral health challenges are more likely to incorporate healthy habits and routines to support occupational engagement and overall performance. For these clients, the OT may strongly focus on physiological factors and implement a biomechanical frame of reference instead, depending on the individual's personal challenges and health conditions. The leisure exploration intervention went very well overall. If I could improve anything about this session, I think it would have been helpful to have the client write out her typical daily schedule before completing the leisure checklist in order to develop a better understanding of their habits, routines, and day-to-day structure. This would allow the client and therapist to better implement preferred leisure activities into the client's schedule and maximize occupational balance. Additionally, it would be nice to engage in the leisure activities such as cooking or walking with the client so that we could problem solve any barriers that arise that may limit engagement in the activity.